Right, so let's have a look at this one. This patient has fallen over, they hurt their arm, and we look like we've got a view of the radius and ulna. So we're having a look, and what you need to do is just really sort of draw along, right, along the shaft, along the shaft, along the shaft, along the shaft. And this is quite important because when you're looking at the radius and ulna, I'm not sure. I mean, obviously we've got different levels of people that are working with us. And actually, if you come to our course, we do cater towards different levels. We've got like ST1s, non-radiologists on our course, but on this one, you kind of just have to try and cater as much as possible for everyone. So with this, what you can see is that, yes, you've got your radius and you got your ulna, right? And that kind of gives you what looks like a ring. So when you've got what looks like a ring, it means that you can get fractures in two places, just like the pubic ramus, just like the jaw. You can get fracture dislocation in two places. So if you've got an injury in one area, you've got to look for an injury in the other. And so if you did have a fracture, and there's something that they call Manchester United. So I don't know if any of you lot in football, I'm not actually into football at all. I get really bored when people talk about football. But anyway, there's Manchester United, Glasgow Rangers, and you've got, so if you've got a fracture of the ulna, then you've got something called a mortegia dislocation fracture. And so that means that if you've got a fracture of the ulna, then you're looking at a dislocation of the radius and ulna somewhere else. And on the Glasgow Rangers, you're looking at a fracture of the radius, and then you'd have a dislocation of the, you'd be looking at a second injury somewhere else as well. In this situation, it doesn't look like we have two injuries, but there is one injury. I don't know if anyone can see. Please do tell me if you can see it. If you haven't seen it, don't worry, we're going to go through it. So quite important that, yeah, okay, fine, fair enough. We do have an image of the ulna and the radius, but we also do have to look at the carpal bones, if as much as we can anyway, to make sure there's no fracture anywhere else. Let's have a look at the other views, and let's have a zoom in as well. And the way to do this is to really get your pen out again and draw around. And no one's saying anything yet, so no one's seen it, so don't worry, I'm going to just keep going. So you kind of go around, go around, go around, and keep drawing around the outline of the bone. Exactly. So well done. Someone has picked it up, so I'll kind of speed up this bit then. And then you also want to draw around the outline of the radius as well, like so. So if you can draw a nice line around everything, then you're doing okay. And then also you want to, let's get the pan function. Is since we've got this view, you want to make sure that everything nicely aligns. There's no perilunate or lunate dislocation by drawing a line like so. But yeah, someone has picked up quite nicely that there is what looks like a fracture somewhere on this. So maybe one, let's try and get one more person before I go to give it away. So I'm going to zoom in. So one person's given us the answer. Let's zoom in a bit. And hang on, there's a Q&A here. I'll leave that open. I would love to see a good example. Okay, so someone has asked for a good example of a Galeazzi. Okay, fine. So I'll have to do that for the next talk. I'll remember that. So, yeah, so some people have picked it up that if you draw a line like so, like so, like so, then you can see that, yeah, there is a sclerotic appearance to this area over here. Everyone can see that. And that's a very, very common place to get a radial fracture, because actually what happened, remember when I was talking about the translation of forces, right? So if someone is to fall on their hand, and if they were to fall on their hand, a lot of the force would go into the radius, the distal radius, right? And then that force goes all the way along the radius. And because sometimes it can be quite a significant force, because everything kind of gets smaller and smaller, the impact is all dissipated into quite a small surface area, which is over here. So therefore, in this situation, what you end up having is a small surface area with a large amount of force going through it, resulting in what looks like the appearance of which you'll end up getting a quite common area of a fracture. And if you come back to this area, it's actually a lot more obvious on this area here. So if we zoom in, you can see like how impacted that is, right? So if we draw a line going along like so, you can see it kind of just fragments like so. And actually, you can also see what looks like a joint effusion and some high density fluid sitting within there. So this is like, I mean, this is what makes you worth your weight in gold, right? When you've got like a fracture, an image of the ulna and the radius, and you've got wrist and all the rest of it, but you spot something that the X-ray is not dedicated for, and that's real value in someone that spends time, learns about X-rays, and goes through X-rays regularly. And that's my opinion, and I think that's what someone like myself is here for when we do the jobs that we do.